let's compare. Let's look at the thing that's most comparable. So she looked at all the injected products against influenza. And it turns out, as you can see, it's decades of data, and it's about 23,000 lots, manufacturing lots. And if you look to the right, the COVID mRNA vaccines, 5 lines down, similar number, 25,000. So they're similar numbers of lots. But if you look at the serious adverse events, you can see like a 5-fold difference there from 9,000 to 47,000. And in terms of deaths, I think that's like 8 times worse. So something very peculiar is happening. These next couple of slides are the crucial ones. So along the bottom there are the meaningless to me numbers associated with all these injectable flu vaccine products over many, many years. And on the vertical axis are the number of serious adverse events. And you can see there were just a couple of exceptions, one with about 22 serious adverse events. A serious adverse event is something that would bring you to hospital, extend your hospital stay, could threaten your life, require urgent intervention to save your life, something like that. These are not a sore arm or a bad headache. This is something really bad. But with the exception of the one on the left there with 23 serious adverse events, a lot might contain several tens of thousands of doses. We don't know what it is every time, but what we can say is that since as I'll show in a moment, since the number of adverse events can vary thousands of fold, it's not possible for the difference in batch size or lot size to be the whole explanation for the differences. Might contribute to it, but we've done some preliminary examination where we have managed to find out exactly how many doses there were in a group of lots. And when we looked at the relationship between the number of doses in the batch and the number of adverse events in the batch, there's no relationship. So that's not the driver. So with the flu vaccines, there were just 2 lots. We don't know why that was. Something went wrong, and there were a relatively large number, 22 and 37. But look at the rest, hundreds and hundreds, thousands, it's tens of thousands of lots, where on average, my eye is telling me that the sort of smoothed average is around 4 serious adverse events per lot. But more importantly than that, I think you'll agree, it kind of looks like static. Just, it's a background noise. Remember, if you dose a large population, you could dose them with saline and get this effect, because people do get ill. You might put on red socks today and have a heart attack. Obviously, the red socks didn't cause your heart attack. But if you were tracking the relationship between your new product with socks and side effects, you would end up with a product with a profile that looks like this. So side effects associated with an intervention does not necessarily mean that it's bad. As I mentioned earlier, this sort of correlation is not causation. But I wanted, and this is really good work by my colleague, I wanted to show you what we think is a normal, well-manufactured, consistent, high-quality product looks like in the real world when you give it to, millions of people over time. So now with that established, and the baseline is around 4, and the highest value was 37. Corvin, if you could show us the next slide. I think it is the next slide, yes. So this, by now, should start to take your breath away. So these are the COVID vaccines. There are 3 manufacturers, because it's the US commercial utilities. So it's just these 3. We don't know about AstraZeneca. But remember I said that the rolling average was about 4 adverse events. Well, the scale on the y-axis here, 4 is thicker than the axis. The thin blue line at the bottom is more than 4. And the red line, this is the worst ever. You can see there was like a single case out of 22,300 flu vaccine batches that was 37. But really, that's probably way over what the representative was somewhere around 4. But there you go, that's the top. Look how many batches of COVID products are worse than that. And yet, let me just point out, for example, right in the center there, 651, 483, 5461, looks like it's either 1 or 2. And then its neighbor 1 or 2, its neighbor 1 or 2, its neighbor 1 or 2. And then suddenly you come on this one here, EN6201, and it looks like it's 600 serious adverse events. Again, these are the ones that are, if you had a serious adverse event yourself, you would think, thank God I didn't die. It was quite close to death. And look at the number of them. And so a number of things I want to point out here. One is the extreme level of side effects that we're seeing. Orders of magnitude, I would say just the rolling average here is looking like, I don't know, between 100 and 200 instead of 4. These are really toxic products. They really are toxic products, and that's bad enough. But as I argued, if you were a cancer sufferer, you might accept a dangerous intervention if on balance it could extend your life and its quality by a year or so. But these products have been given to the general public, most of whom are perfectly well. That's the normal deal with the vaccine. You're perfectly well, you turn up at the doctor's office, get an injection, and you leave, and you're still perfectly well. And all that's happened is you've acquired a defense against a specific pathogen. That's the deal. What we shouldn't have is that you occasionally get seriously ill and some of you die. That's not a good deal. That is what is happening from these products. And they're being pushed on everyone when, as I've argued, if you're recovered, infected, you're immune. If you're a child, you're not vulnerable to the virus. Just healthy young people not, and pregnant women, we do not know that it's safe and should not, on the precautionary principle, be administering it. And yet your governments are pushing these on you. It's not a public health measure. If it was a public health measure, the 3 or 4 things I just said would be true. It's not a public health measure. And all of the stuff I said earlier about discarding normal pandemic handling plans and replacing them by absurd lies that have had the effect of frightening people, and we think that was the objective. Now you've seen this information, and your economies are on the verge of absolute extinction. And so I think that's the evil triumvirate: frighten people, damage the economy, persuade them or force them as necessary to accept these injections, some of which are killing people. Why would they want to do that? This is why I got to the conclusion. I racked my brain. There may be other explanations. It's not money, by the way. The pharmaceutical companies, of course, are having an absolute field, a high watermark in terms of profitability. That cannot be the motive. It's the effect of using big pharma to drive these products into the population. That can't be the motive. Why can't it be the motive? Because there are huge numbers of industry sectors that are absolutely almost into the ground. The airline industry, I don't know how they're surviving. Almost 2 years of non-normal operation. Hotel and catering, holiday trade, and all of these things. So remember that the only people who could possibly make this happen, or at least have to agree in order that this happens in their world, would be the owners of, the people who own what Catherine Austin Fitts calls, Mr. Global big capital. So I'm absolutely sure that money alone, profit alone, is not the motivation, because 8, there might be a couple of sectors doing really well, but 8 sectors are doing so badly as to more than outweigh the benefits that accrue to the drug companies. But let's just go back to that slide, please, Colvin, if we could. Yeah. Because there's something, not just is there this extreme toxicity, but it's the variability. Now, I pointed out, so let's just look at the Pfizer bunch, because there's a nice range there. Nice is the wrong word, sorry. I'm sounding like a scientist. These are people. These are people who've suffered, and some of whom have died. But as you cast your eye across the axis at the bottom, you can see that some of the numbers there are associated with very small numbers. They're so small that you can't see it registering on the thickness of the x-axis marked, y-axis marked 0. And yet close to it, there are a whole bunch of batches that have got, 400, 600 serious adverse events per lot, and they're roughly the same size. That means there's not the same product that's got this Pfizer COVID-19 vaccine. It says on the box or on the vial, it's not the same stuff. It's not the same stuff. I'm certain. It's not an assessment. It's not maybe. I'm absolutely certain. There is something called the law of mass action, which applies to all biological properties I've ever seen. And if it does come to court, I will walk you through the history of that and why it is that shape and why this means it cannot be the case that these middle Pfizer lots are the same material as the ones immediately to the left and to the right. These drug companies are highly professional outfits. They know how to manufacture reproducibly, and we saw that with the flu vaccines over decades. They know how to do it. They haven't done it. I'm afraid I've come to the conclusion that they're doing it on purpose because they're so professional. And after a year, they know this data. This data is their window onto the world. They can go into VAERS, they can filter for their own products and their own lot and batch numbers, and they can see what's happening. They know. So the fact they haven't stopped this tells me that they're at least okay with it, and I fear that this is deliberate. Why might it be? Why might it be deliberate? Well, as we have seen over the last 2 years, big tech like Google, Facebook, YouTube, Twitter, and so on have persistently said we're not having anyone making a comment or a recording that disagrees with what the public health officials say, and we're going to call that misinformation, and we're going to basically will censor you and maybe deplatform you. What that means is that a qualified person like me, and I promise I have no axe to grind whatsoever other than telling you what I think is true, which is that we're facing a global crime. People like me cannot speak to the public because the tech companies have decided not to let me. And that's true of mainstream TV, mainstream radio. I've only ever appeared on radio where they maligned me. They just told me lots of lies. So I then threatened them, and then they deleted the recording, which tells you something, doesn't it, that I was correct. So what do I? Yes. So it's the combination of big tech, big media, and by that I mean mainly TV around the world. They control what's coming into your house. So if you just turn your TV on over the last 2 years in the same way that you ever have, you're only going to hear a one-sided, and in my view, it's mendacious. It's a completely misleading description of what's going on. You'll never hear things like this, and you should see both sides of it. The fact you're not allowed to, I think, tells you that they know there's something bad going on, and they're going to make damn sure that people like Dr. Mike Yeadon and Dr. Robert Malone and Dr. Peter McCulloch and so on will never darken the studios of BBC or CNBC. Because if we were given an hour, I think we could destroy this story easily. I think we're plausible, we're being honest, and I gain absolutely nothing from making up stories I'm describing in horror. So I've said that the variability is extreme, and I've said that the media controls the message and they censor people like me. If they want to tell you that there's a nasty variant that's just come along that's killing more people than previously, you've no way of knowing if that's true or not. And I don't think you should trust anything they say about this, because they've definitely lied about everything else I've been able to hear. But let's say they did say that. Let's say they said there's a new variant or a new virus that's, say, 10 times more lethal than COVID. And don't worry, the innovative pharmaceutical industry has rustled up a new vaccine, and run and get your top up, your booster, your new vaccine. What happens if they chose to give you that one that's called EN6201 instead of the one to EN1201? Well, the answer is, probably thousands of people are going to die. And imagine all the manufacturers doing that, and over time and across the world. All the time, the media is giving you a very frightening message. And the appropriate response, if these guys were being honest, would be, okay, let's deploy these vaccines as we tune them and so on. But it's all lies, it's all misleading. And I worry that what you've seen in front of you there, I've described it to other people. I said, I'm worried that this is calibration of a killing weapon. That if somebody wanted to say that there are viruses or vaccines that are, say, 10 times more lethal than COVID, so killing 1 in 100 people instead of 1 in 1,000 roughly, they could just move along and just deploy batch X or batch Y or batch Z. And that's what would happen. And, I've got no reason to make this stuff up. I've never been a conspiracy theorist. If anything, I would be the sort of person that would chuckle at other people having conspiracy theories. And of course, now I realise what a mug I've been for the last 61 years, believing what I've been told. So the bottom line, you can see it from here. It's not the same stuff in each glass bottle. That's an offence in all sorts of ways against the Adulterated Drugs Act. It cannot be accidental because they are professionals that know how to manufacture consistently. It's not possible that this is small variation in product because it's an emergency situation, difficult to make. No, the law of mass action would mean that in order to get these enormous differences in quotes performance, serious adverse events, would have to have a sizable difference. I would say, I don't know, 10 to 100-fold difference in an active. If there was an active that produced these side effects, I'm confident, and we did the experiments, and I'd be roughly right. I've done hundreds of experiments like that, not with people, of course. And we'd need to go up in dose by 30, 100, 300 to go from baseline to these numbers. I'm absolutely sure about that. I bet a lot of money on it. So because they're good at manufacturing, and because this data is available, it's been available to them all the time. They can look as the VA ERS data comes in. So they've known about this, and that means they're good with it. They're good with it. So it's either intentional or if it has proven too difficult to manufacture, they should still not be allowed to discharge these, as it were, into the public environment because they're very lethal. I'm trying to think. There's something very important I was going to say. Yes, some people have said to me, Mike, these are brand new products, as you've said. And early on, we heard, I think the Pfizer product had to be stored at like -80 centigrade. So that means they're a bit unstable, rather unstable. Maybe, Mike, what's happening is they're just going off. Occasionally, bad handling, people not used to a cold chain, what's called a cold chain like this. Well, I don't think that's true. One, when products degrade, they generally lose activity. A piece of it falls off. If you imagine a car degrading, might lose one wheel and the top part of the engine. It doesn't suddenly turn into a lethal, flying machine. It will lose function, and that's what I would expect to happen. Now, on a one-off, maybe a novel product like this might break in half, and you end up with 2 super toxic bits of mRNA. But we're seeing the same thing with 3 products made by 3 different companies, and we're seeing 2 different technologies. So Moderna and Pfizer are mRNA. The Janssen is a DNA. No, it's not possible. I've just said the rule of thumb is degradation results in loss of function, not acquisition of exquisite toxicity. And we've got 3 products and 2 technologies doing that. No, that's not the explanation. And here's the thing, I have no idea what it is they have done, but I'm more frightened of these vaccines than I was before seeing this work with my colleague. So I think that's the long and short of it, really. So all of the early stuff, you're being lied to, and I can prove that in several occasions. And I would like, as I say, to direct people who haven't seen me before to my interview with Adele Bigtree on Highwire, and that I think will educate you on what I was seeing as the principal lies. And then I certainly would like to attach a short, I think it's 16 minutes with 3 or 4 people talking, that will provide you convincing evidence that the authorities knew that asymptomatic transmission was complete garbage. And if that's true, and it's true, it's garbage, everything else falls to pieces. And then when we come to the vaccines, if they were a public health measure, they'd be directed only to the people who most could get benefit from it, and never to children, healthy young people, pregnant women, and those who've already recovered. And yet, coach and horses has been driven right over those. So that's about where they are. And the reason I'm here is I want to work with anyone through the Corona Committee and anywhere else that can help wake people up, because I don't know how to fix this, but if enough people say, we've had enough now, we're not going to comply with it anymore. I noticed in Northern England, there were a group of several thousand children from secondary school in Lancashire, and they formed a union. And Wolfgang and I were talking about unions a few days ago, and they just said, do you know what? We're not wearing the mask to school anymore. And no, we're not going to put these cotton buds up our nose twice a week, not doing it anymore. And that's all we need to do, because I am telling you, there's no unusual threat in your environment except from your government and their policies and the pharmaceutical industry. There's nothing going on other than the sort of psychological warfare the economic damage, and then these wretched vaccines. So we can still take our old normal, hopefully in a better form, back, but it requires us to just take a little courage in our hand and say, I do not comply anymore. I do not comply. And you're not doing anyone any good by complying. You're not saving yourself. You're certainly not saving your children. So that's all you need to do. And they can't arrest everybody, right? One or two people decide to demonstrate they could be arrested. If 10,000 school children say, we're not going to school with masks and testing, and they just cross their arms and say, what are you going to do then? That's how you take it back. That's how we take it back. Anyway, I'll pause now because I've talked for quite a long time, I think.